Hi everyone, wherever you are watching us from or will be watching later, you are welcome to Raising Health. My name is Priscilla Owaramwata. You can call me Priscilla O. And today I have got a really great person here with me who is going to talk about kidneys. If you hear Rosaline talk about kidneys, she's just passionate about it. And I think I've never heard anyone talk about kidneys the way she is. You are going to like it, and it's going to actually reveal things that you never thought about when it comes to kidney health. So just stay with us as we break it down what kidney health is all about, why it's even important for us to be talking about it, and why we say it is a silent or hidden
Mhm.
disease. So here is Raising Health. I am so happy we are doing this, and stay with us as we go through this. Rosalind,
Yes,
oh, thank you so much for coming.
it's a pleasure. I
Before
love
I even
doing this.
continue, I'm
Mhm.
sorry, I did not mention she is a kidney nurse researcher. So that means she knows what she's talking about. So she's not just going to be fluffing around anything. She knows what she's talking about. She's also a clinical educator. So, well, I won't say more. Let's get to it. Oh dear.
Mm.
Um, I have a first question.
Yes, please.
What led you to kidney nursing? And what keeps you so passionate about it? Because I heard you talk and I know you are. So what led you to it?
It's a combination of personal experience,
Mm.
professional curiosity, and finally, a calling. Now, sometimes when I
Oh,
add that, then people will say to me, Rosie, you need to leave your faith side aside and just talk about
oh,
the personal and professional stuff, but that is just me. I cannot separate myself from the triple me. So I keep all of that intact, and that is what inspires me. So,
I
as
love
a
it.
personal experience, my first encounter with kidney health was when an auntie's husband developed chronic kidney disease. At that time, I was in Ghana. It was the early part of my nursing career. I was in
Yeah.
Ghana, and he needed dialysis. I think he only did about 2 or 3 dialysis sessions. And then he said, you know what, enough is enough. I can't continue with this, paying all this. And then at the end of it, what is life? So, guys, just let me be. Let me rest peacefully.
Yeah.
I was then working in National Cardiothoracic Center where we had a dialysis unit. Okay. So that bit there, I thought, okay, yeah, that was it. I wasn't so much curious that because then my whole clinical expertise was on cardiothoracic nursing. So I
Yeah.
didn't know much about kidney
About
health.
kidneys. Yeah.
The next person was my auntie, who then developed chronic kidney disease and needed dialysis and came to the same place where I am working.
Mm.
So then I thought, there must be something about this kidney. But
Yeah.
even still, it was the early part of my nursing career, so I didn't know much about it.
Yeah.
Then, where the reawakening started was we had a young patient who had bypass. So, this is heart bypass done. And to me, we have fixed the heart, and I thought everything was okay. And the patient then developed what we now call acute kidney injury. I could see on the faces of the anesthetist and the cardiac surgeon, everybody is worried. So I thought, guys, what's the matter? We fixed the heart. They said, okay, Roslyn, you are young in your career. You don't know what Mr. Kidneys
Mm.
can do. And I'm like, Mr. Kidneys? You even add a title to
Have
it,
a name for it.
Mr. Kidneys. I
Mm.
said, wow, personification. I said,
Hmm.
that is big. He says, yeah.
Yeah.
This acute kidney injury can actually kill this man. And I'm like, not the heart condition. Oh, no, 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 no. Not the heart condition, but the kidneys.
Mm.
Okay. Then, interestingly, we opened a dialysis unit attached to the National Cardiothoracic Unit. So it was
Yeah.
ICU dialysis unit.
Yeah.
Then I was working in the ICU, and for some reason, I moved to the dialysis unit. And it was only based on a personal complication. That is why I moved there temporarily. And whilst I was there, my interest in that field of nursing grew. I thought,
Mm.
these patients are different. They talk to me. They can talk back at me. They can tell me what is actually happening. Whereas in the intensive care, all my patients are quiet,
Yeah.
intubated, mute, sign language. I love that as a skill, but I love my patient to tell me what is it they are experiencing so that together we can form the plan. That is where my interest grew. So I went up, had a baby, came back. Then when I came back, I was back into the ICU. Then my colleague, who was then the manager in the dialysis unit, left for UK. That became my
Okay.
opportunity. So we were asked, who is interested in dialysis? Me. I went. But as I started caring for the patient there, I realized that I didn't know enough. So
Mm.
this is where the professional curiosity comes in. I
Yeah,
didn't know enough about kidney health. What I was doing was more of mechanical, but I wanted to understand the human part of it, the
exactly.
emotional load and everything. So I started Googling.
Mm.
Okay, who knows anything about kidney health who can teach me? I found an online mentor. This is 1998. That time, all we had was Yahoo. We didn't even have Google. All we had was Yahoo. Found her.
Yeah.
And then I said, I'm passionate about kidney health. I'm working as a dialysis manager. What I'm doing is what I have read. I don't want to just do what I've read. I want to know what I'm doing and be able to explain it. So then she
Yeah.
said, there are two options you have. Either you can go to South Africa and educate yourself, or you can come to the UK or go to US.
Okay.
Somehow I found myself in the UK. But even then, my passion has not gotten to that pinnacle
Yeah.
until my sister, the one I come directly after, developed acute kidney injury.
Oh
And
dear.
within 48 hours, she was gone. That
No.
was the reawakening. So now my auntie's husband is gone.
Mm-hmm.
My auntie is gone. My
And your
sister is
sister.
gone. This
Oh,
is three. This now hurt.
it does.
So this is me working at a dialysis unit, and I'm thinking, must I actually stay here and wait for people to come to me? Can't we do anything? And because I had started in Ghana with the dialysis, I didn't know much about the patient's journey before dialysis.
Yeah.
So here I'm working in Baths and I'm thinking we need to do something. We need to do something. Then an uncle developed chronic kidney disease and dies. Then another family member developed chronic kidney disease and dies. And I'm like, this thing.
This
So
is
I
getting
moved,
tricky.
this is now really touching the very fiber of me.
Yeah.
So I moved from Baths and then I came to Kings. When I got to Kings, that was a really huge reawakening. I'm like, okay, now everybody here on dialysis is me. Almost
Mm.
everybody on dialysis at Kings is me. That is, they represent my community, they
Yeah.
represent me. I started asking myself, okay, what did my kind do?
Mm.
Is there something up there in the system I don't
It's
understand?
causing
Why do
it.
we have?
Yeah.
I said, wait, okay, hang on. Roseline, the census, how many of me are actually in this country that there should be so many of us on dialysis?
Yeah.
No, this is
Yeah.
not right. There is something somewhere that I do not understand. But because my career had veered into academia, I didn't know how to navigate myself back into the clinical area. Then COVID hit. And interestingly, there was a national shortage of dialysis supplies.
Ah.
So then they said, Roslyn, yes, we need somebody to go to intensive care unit to go and train the nurses there how to dialyze a patient. We need you to actually take some of the dialysis nurses, train them there. And I'm like, okay. So I went to intensive care during COVID. And I'm like, okay. So everybody here developing chronic kidney disease, every dialysis patient or transplant patient who is losing their transplant is me. No.
Mm.
This inequality,
Yeah.
there is something somewhere. So I've been thinking, what is it? What is it? God, what do I do? How do I navigate this path? And God is wonderful. I was just there minding my business. One consultant walks to me. Oh, hi, Roslyn. Yes. I would like to pick your brains. You know how they say it out. So I'm thinking, pick my brains, pick my brains. So my colleague is saying, ah, Rosemary, don't listen to her. When she says pick your brains, it means she's going to use you. Then I said, first, listen. then discern. So let me go and listen to her. And what she said to me is a revelation. There is a project I would like to do. The project is about identifying chronic kidney disease early. I said, pause. Then I said to her, that is my calling. She looked
Mm.
at me thinking, okay, Roslyn, I don't understand what you're saying. But what I know is that this very thing I want to do, now listen to this, Priscilla, I am not the appropriate person. Then I said, pause.
Mm.
She said, you are. And then I said, okay. You know what? You're not saying this by yourself. Roslyn, I don't understand what you're saying. So this is how what keeps me passionate is personal,
Yeah,
professional curiosity and a calling.
yeah,
Because even if I had felt it was just me daydreaming, it has taken a white person to say, I am not the right person. You
yeah,
are. That is something I hold dear to me.
yeah.
And by the time I started Hidden CKD, I had lost 9 family members. And I want that to be the last.
Oh, yeah.
Not just for me, but I see far too many of us starting dialysis new
Yeah.
without knowing anything. So this is what keeps me passionate.
Wow.
Yeah,
Such a story.
definitely.
I am so glad that you took it up because this is very important. And I mean, if we are a minority
Mhm.
and most of the people having dialysis are part of the minority, that is a big issue.
It's a very huge issue.
Now, let me move to my next question. Why
Yes.
is kidney disease often
Mm.
discovered late?
Hmm. This is very interesting in the sense that it is silent at the beginning,
Mm,
but then the early signs are also dismissed, misunderstood,
mm,
not just by the individuals who are affected, but
yeah.
by the system that has been designed. We have a fantastic healthcare system, but our fantastic healthcare system is very reactive. So something has to happen to you quickly for us to do something
Do
about it quickly.
something. Hmm.
No, something has to happen to you quickly for us to do something about it quickly. We fixed it. Our system has not been designed to identify the leaking tap very early on
Yeah.
and fix it
Unless it's flooding.
unless it is flooding. So this is where we have a problem. Secondly, we normalize some of the symptoms that we experience. So somebody may be having headache and think, "Ah, it's just because I worked too tired. I am tired. That is why." One of the key weaving thread is communication.
That's my area. Now you're talking my language. I know it's a huge
So
problem.
how we communicate is a
Mhm.
huge
It's a
problem.
huge problem.
Also, we bring our cultural values into that communication. So I go to the hospital and I see the doctor as here. Power distance immediately plays a role. So I am now thinking, how do I tell this doctor what my problem is? Now, that doctor only has 15 minutes. And if I am an indirect person, by the time I am coming to my topic, what is really wrong with me, my consultation is over and I've been booted out. So the way the system has been designed, system, communication ethics, all of that just keeps chronic kidney disease hidden until there is earthquake. But it shouldn't be so.
Yeah,
It should not be so at all.
it shouldn't.
No.
It's a problem. Sometimes I feel like we are doing equality when
Mhm.
it comes to navigating the healthcare system or even communicating with regards to patients and the way we explain things to them. We do it in such a way that it's the same for everybody, the same time that you were going to be using for most people, even though the awareness of having to adjust for different people, but mostly I know it's with learning disabilities that people pay attention to. Um, but the cultural aspect of things still is missing. Just that equitable way of communicating is still very lacking.
Cross-cultural communication is a huge thing when it comes to healthcare professionals.
Yeah.
It is unfortunate, and it is not just here, Priscilla. It is globally.
Mm,
First of all, why? Majority of the textbooks we use in healthcare were written here,
mm,
were written by people within a certain cultural system.
yeah.
So how they understand, perceive, articulate things is totally different from when you take
How?
that
Yeah.
same context and then you
Yeah.
place it in a certain social or demographic
Exactly.
area.
Yeah.
And as healthcare professionals, although we have been taught you have to communicate with the patient very well, that cultural nuance of how do I communicate with one patient versus another patient, we are
Yeah.
not able to clearly articulate that. For example, I had a colleague come to me and then said, Roseline, and then I said, what is it? That patient in the room is not engaging. So then I asked her, define engagement. She just looked at me and said, sometimes you are weird. I said, no. Define engagement. Okay. The patient is not looking at me. And I said, where is the patient looking? The patient is looking down. Okay. The patient is not engaging her eyes. And I said, okay, right. And then I said, first, ethnicity. So she looked at me. She said, I said the patient is not engaging. You're not even asking me what the patient's condition is. You said ethnicity.
Patients are not the same.
I said ethnicity. Then she said, Black. Thank you. Age. She said, does that matter? And I said, yes. Age. She said, in her mid-50s or early 60s. Then I said, okay. I said, I understand. She said, what do you mean? I said, that patient is fully engaging.
Yeah.
That patient respects you to the
You.
point
Hmm.
that
They don't want to
because
look at you.
she or he has brought power distance into the consultation. You are the doctor.
Hmm.
She or he is the patient.
Hmm.
She said, I beg your pardon. I said, yes. And
Yeah.
then I said, the other thing I would say is that, what else were you doing when you were talking with the patient? And then I said, actually, to the patient or with the patient. She said, Roslyn, I said, there are two different things. You can
Yeah.
talk to the person, talk at the person,
Hmm.
or talk
Talk with them.
with the person. So she said, oh, I was busy typing away. And I said, that is even worse. So let me ask you, what were you interested in, or who were you interested in?
Yeah.
Her symptoms that she brought, or this information that you need to put down with this keyboard? And I said, that keyboard. I said, you have no idea that little sound from the keyboard. I said, me, you type in my, I don't hear a thing. She said, oh my goodness. So she said, no, Rosemary, just leave me alone. She ran to the reception. Where is the patient? They said the patient is gone. She ran on the corridor, went to beg the patient, and I brought the patient back.
Yeah.
So she has understood it that way. And that patient was going to go and then come back. I said, do you know why? I said, do you understand why our A&E system is at a breaking point? She said, what do you mean? I said, it is consultations like this. So this patient has left your consultation, issue and dress. The patient goes home, okay? Then the problem starts again. The next thing the patient
Gonna
goes
be
to
back.
A&E.
Readmission.
I said, majority of the people who come through A&E who are on the mission, they don't need to be there. It is just somebody to
Yeah.
listen differently,
Yeah.
communicate differently, understand them. We
Yeah.
wouldn't have all the problems that we are having. So the reason it is discovered late is a system-wide thing, communication, and then it is also cultural lenses all weaved into. And a
Cultural
lot of
intelligence.
us as
Yeah.
healthcare professionals, we need to be aware.
We need to be taught it because I keep saying that we keep teaching people are being taught communication skills, but there is a clear difference between communication skills and actually teaching people to communicate the way that people understand. Well,
One of
that's
the
another
things
thing.
as a, as as somebody in education, anytime somebody said, Roslyn, they need training, I said, no, they don't need training. Roslyn, they need training. I said, no, they don't need training. Why do you keep saying that they don't need training? I said, Three things I always look at. What we are looking for is behavioral change.
Mm-hmm.
So the B is the last one. I said first, do they have capability? She said, yeah. Do they have capability? So we've trained them. Yes. Second, have we given them the opportunity? What do you mean opportunity? Yes. So if they know they are going to be assessed, if they know somebody is listening, if they know we are looking at all the risk and all the complaints that is coming in, we are identifying themes and we are going to hold people responsible, but also train them. They would
Yeah.
know this is what is required of me. And then
Yeah.
finally, are they motivated? Is the environment safe? Are there opportunities? Do they have the tools they need to the person student? So I said, it's not just communication, it's a whole package. What we are
Yeah.
expecting is for healthcare professionals to shift that behavior of engaging properly with the patient.
Yeah.
But when there are no structures in place to ensure that that is done, what happens in the classroom can never be translated. Knowledge transfer, there is a whole transport mechanism that cannot be transferred back into the clinical area unless those structures are there to ensure people are transferring and people are being motivated and held to account to transfer. At the end of the day, it ends up the same way. It's the patient who struggles, but most
Yeah.
importantly, it's the healthcare system that keeps spending money
We keep sinking
sinking, and then it is the taxpayer who keeps
and
putting
pay.
money into a sinking ship. The Titanic, it started with a little leak, but it was
Little
going to
leak.
go down.
It was going to go down. Okay. Well, I'm gonna be full by the time I am through with this. Oh Lord. Well, let's go on because
Yeah.
now we've learned that identifying symptoms early and even acting upon it early is a problem. It's not being done. The way we are communicating when it comes to this condition and even other conditions, it's also a problem that needs to be addressed.
Yes.
Now, how would you explain what the kidneys do in simple terms in everyday language?
I think the first time I said is somebody said, say that to me again. Our kidneys are the body's caretakers. The person said,
Hmm.
eh? Yes. They are the unsung hero, the body's caretakers. One thing the kidney does, cleans our blood, help us balance fluid, support our blood pressure, protect our heart, makes our bones strong, keep the whole body in a good rhythm. From morning, every food I have eaten, every fluid, water, juice I have taken, if my kidneys are not functioning very well, there is complete blockage. And the
Mm.
kidneys do this all day without asking for any attention. All day without asking for any attention. That is the thing. And
Wow.
because they work so quietly, not tagging anything, it's not like your heart that you can feel the heartbeat, but the kidneys are there quietly, keeping the whole body systems together. So when something goes wrong with the kidneys, the whole
The
body,
whole house comes down.
it's the whole house that is coming down. The thing with the kidneys is that it can compromise itself and compromise itself and compromise itself and compromise itself until it says, I have been warning you for a very long time. There were tremors for a very long time, but there were no attention being taken.
Yeah.
A volcano does not erupt in one day.
Mm.
It doesn't erupt in one day. There are warning signs before. Yeah,
Wow. So the kidneys are the caretakers of the body. I'm gonna keep this. I'm gonna write it somewhere.
they are the caretakers.
They are the caretakers, the unsung heroes. Wow. You describe kidney disease as hidden.
Mhm.
What does that look like in practice?
And this is one interesting thing. The symptoms are subtle. They are easily normalized. And when we are going to explain the symptoms culturally, that is even a different thing altogether.
Mm,
So somebody may feel that something is off, but they will normalize it to say, I didn't sleep well yesterday.
yeah.
That is the reason. Hmm. It must be that food I ate. Some people may also bring that in culturally, not be able to clearly articulate that.
Yeah.
So hidden looks like the blood pressure is raised, the person is having headache, but the person thinks, I've been working too much. It's a lot of pressure at work. I remember as a child, so anytime I say this, people laugh. I heard about the word hypertension before I knew that it was a medical term.
Yeah.
I thought it was something else because my mother used to say it, don't come and give me hypertension. So as a child, I didn't know that hypertension was a medical condition until I went to nursing when I was, the
Yeah.
first time I thought, what? So I was trying to explain this to another colleague, and I said, can you imagine my mother assuming that hypertension is something her children give her?
Hmm.
So she comes to you as the doctor, and then you tell her she has hypertension. She'll just sit there and then look at you and say, uh-huh, and so? And
Yeah.
then now you want to give her medication. And then she said, yes, Rosen, we need to treat it. I said, but the children are still at home. Oh, my colleague just burst out laughing. She said, I get the picture. I said, you get the picture?
We have to take that stress out. We take the children out, and then the stress is
I
gone.
said, the children are still at home. You want to give her medication to treat the hypertension. It doesn't work. Because this
That's
is how
funny.
this is, and anytime I say that, the whole room will be, there will be people laughing. I say, this is how she has perceived it as a child. This is what I knew what hypertension is. Until I went into nursing. So how
Yeah.
many people like me have heard about hypertension and think it is something your children give you?
Yeah.
And it is because of that all the symptoms are settled. We frame it culturally in a particular way, so people don't see it. In my own personal experience, when I delivered my little boy, so he's
Yeah.
10 now, I was discharged on the third day. As I was going, I took one look at my leg and then I thought, have I suddenly grown very dark? No, this is not right. So I called one of the nurses and then I said, could I please have a look at my blood results? First, the printer is not working. I said, okay, all right, that's fine. Could I please come to the nurse's station and have a look at my result? That is the nurse's station. Patients are not supposed to be there.
Mm.
Okay, that's fine. Could you please go to the other ward and then go and print my blood result and bring it to me? That is not allowed. Okay.
Really?
So I thought, hey, Roseline, these people, they don't know. They want to see, they
They want
really
to
want to
test you.
see the other side of Roseline. But you know what? No, I am not going to. So I will wait. Because I look at myself and I know
Something is
something is
off.
not
Yeah.
right.
Mm.
Okay. So this is me, I'm waiting. Here comes in the registrar. Um, Hi, Roslyn. I said, yes, you are going home today. I said, are you referring to me? He said, yes. I said, okay. So you mean you have discharged me? He said, yes. I said, that's not possible. He said, "Eh?" I said, yes. I say it is not possible. You write that discharge letter, bring it to me. I will shred it in pieces because me, you're not discharging me. So he looked at me and I said, please,
Yeah.
don't look at me that way and label me. I have asked for my result. No, but I said, before you discharge me, could you please give me a printout of my blood result? Is it yours or it is my blood result anyway?
Have they looked at the results though?
So he said, okay, goes, didn't come back. So after 2 hours, I called the nurse and I said, oh, yes, you've been discharged. And I said, please, I have said this very hospital, I am not living here. This ward, I am not. I said, please go and get me your consultant. Don't bring the registrar. I said, I'm not being rude, but don't bring the registrar again. Go and bring your consultant. So at 1.5 hours, the consultant comes in. And then she said to me, Roslyn, I understand you have queries. And I said, yes, I do. I said, first of all, have you seen my result? She said, no. I said, could we look at that together? So she goes, comes back after 5 minutes and then says, what is your hunch telling you? I said, what my hunch is telling me is that I've not looked at my blood result, but I know there is something wrong with me. And I am not going to be discharged. I said, you see that patient there? I'm not referring to that patient. I met that patient here. She was discharged the next day and brought back in the night. That is not going to be me. I will
Mm,
go home and come back.
yeah.
So she said, thank you very much. Let's look at this together. So she looked at the result and then she's looking at me and she said, thank you for being firm. We
Mm.
need more patients like you who stand by what they feel and what they know. So I said, okay, now hit me. She said, you have acute kidney injury. And I said, okay. I looked at my legs and I thought something was off. Now, Priscilla, I stayed in that hospital for another 3 days. But here is the thing. I could have normalized it to say it's okay to feel that way when you give birth. It's okay to feel tired. It's okay to have headache because I was having headache like hell. But no, I said, something is off. I am not going to take it. I need somebody to at least show me my blood result. Let me know. So it is hidden in the sense that it is woven in everyday things, and culturally, we may interpret that in a different way. Possibly it is because it is me, I had the confidence to ask, but other people would not have had that confidence to ask. So again, we could see that it is hidden system, culture, communication, all that weaves into everything centers around system, culture, communication, ethics, everything centers around it.
That's true. It's just, when I hear things like somebody should be more firm and confident, this is you. You are a professional. You were a nurse.
Mm,
You have practice in kidney. So you know this.
yeah,
How about all the hundreds and thousands of people who have no idea? They
precisely.
don't have to be the ones to be telling you to look at them again.
Yeah,
So sometimes I have a problem when, we make it look like the patient did not
no,
advocate for themselves
no,
enough. Because this, you can't put it on the patient.
not at
That
all.
due diligence should have been done before
Not at
you
all.
are being discharged.
Not at all.
Imagine not looking at your results and
Mhm.
discharging you. Imagine not examining you well and asking you, do you feel okay? So sometimes these are the few things that you can actually do. Ask the person, are you feeling okay? If the person is not feeling okay, you do something about it.
Yeah, definitely.
And really, sometimes shame on shame, and I'm gonna say it, I want to be mince words.
Mm,
I have so much issue
mm,
with nurses, colleagues who do not listen to patients and decide, okay, so the doctor said you are being discharged, but the patient clearly
mhm.
has issues with going home, says, I don't think I'm good.
Yeah,
And you think, no, the doctor said you have to go home. No, I don't work for the doctor.
yeah,
I am here because of you. So if you are not good, let's look at what is making you not good
yeah,
and we deal with it. So I always have issues with that. I said we need to teach patients how to advocate for themselves. And then two, we need to also be confident enough to say the patient says they are not well. Can we look at it again
yeah.
instead of pushing them out? So I'm so happy you stood on your grounds.
No. And when it comes to patients, I advocate for patients. And I
Every
think it
day.
has to be what I always call psychological safety. It starts from the environment where people are brought up as children. Psychological safety is not just about you in the working environment, but as
Mm,
a child, were you brought up in an environment where you can say no and
yeah,
you were respected as this is no? Was your decision taken as part of this is how we are running the home? A lot of, if we look at the nursing workforce here, we could clearly see that majority of the nursing workforce are ethnic minority. So we
that's
come into the workforce with
With
our
the
own
same, yeah,
cultural values, where
yeah.
at home, majority of us did not have that. And we see the doctor. So sometimes people think power distance. No, we see the doctor as this is the doctor. The
Whatever
doctor
he
has
says
said
is
that. So
final.
what the doctor said is final. No, the
That's not
doctor is a
working.
human being. And the
No.
doctor can make a mistake, and the
Yep.
doctor is looking at a book, and the
Mhm.
doctor can get it wrong. And it is okay to say,
Can we just take it back?
just have a look at
Let's
this
see.
again.
Yeah. Yeah.
Have a look at this again. And let's see, is that in the best interest of the patient?
Yeah.
Or is that healthcare professionals' convenience process?
Yeah.
Because we have to call a spade a spade.
Spade is spade.
That is why I said we have a beautiful NHS system, but our system is still reactive. We haven't gotten to that point
Yeah.
where we would be exactly where West Streeting wants us to go.
Yeah.
From cure to prevention,
Yeah.
we are still miles away. And the workforce itself, the workforce themselves, they need that mind shift from curing people, from treating diseases to preventing the diseases.
Yeah.
So this about the physical structure, the processes, the guidelines, the policies that needs to change. But change will not happen when the mindset of the healthcare professionals have also not shifted from
That's true.
treatment to prevention.
Yeah. It's very true.
So when we look at why it is hidden, we could see weaving into cultural intelligence. Do I really know what is happening here? Can I communicate with this patient at the level that they can understand? Communication ethics. Am I speaking in the way that this patient respects that and sees that as valuable?
Yeah.
But also community-rooted engagement. Can I engage with this patient and understand them? Have I created that psychological safety? Or this clinic is, I am the doctor, and you look at me, and what I say, you just take it and out of here. And the whole healthcare system designed to reflect people's lived realities. These are people's lived realities.
Yeah.
Unless we get to that point, chronic kidney disease will still remain hidden.
Yeah. Sadly. Um, we've talked about how it can stay hidden in practice.
Yeah.
Now let's talk about the signs and symptoms because I'm very interested in that too. You mentioned that sometimes when people start feeling in a certain way, we attribute it to any other thing at all. The thought of kidneys never ever come to our
No,
minds.
not at
What
all.
signs or symptoms do people overlook or normalize?
First of all, is that subtle tiredness. Now, that doesn't mean that every tiredness is related to the kidney. But if I think about the kidney as my body's caretaker,
Mm,
when my caretaker is unwell, I will not be taken good care of.
yeah.
So, tiredness, it starts with that. Or somebody sees that the feet is swollen.
Hmm.
Or sometimes somebody notices that they are waking up very often to wee, especially at night, or they are
Okay.
having headache, or they are feeling, and this is the thing, you feel that something is off, but you don't feel ill enough to report it.
Yeah.
So you think, no, I am not ill enough. This is the thing about somebody said to me, why is it that Roslyn, a lot of ethnic minority go to the hospital late? Then I said, it's not they go to the hospital late. I said, as a child growing up, you've been told to man up.
Yeah.
And especially when it comes to men, they man things up. So they may have headache, they
As
may
if
have high
dying.
blood pressure. They will, I said, to feel sick means that you are
Yeah,
crawling. She
dying.
said, what? I said, that is the definition of sick.
Yeah.
So it is interesting. Yesterday I was at a church and I was talking about kidney health. And I said something to them, the whole room, they were laughing. I said, when the doctor who spoke before me said that our men do not prioritize their health. And then I said, actually, that is not entirely correct or entirely accurate. It's not that our men do not prioritize their health. The way men have been wired up to be the providers of the home.
Hmm.
So a man would put provision first before his health. The
Yeah.
man is thinking, what is on the table to feed this family?
Hmm.
And then when I finished, I said, today I would like us to change that. And all the men were saying, yes. I said, first of all, I said, do I have my sisters? Yes, sisters, aunties. Listen, first of all, let us prioritize the health of our men. When we put the health of our men on the table, there would be food always.
Yeah.
But when we replace that with money, believe you me, how many of you want to be widows? Because your husband will become unwell, then that money would stop. So let's prioritize. I said, you can see your husband is not feeling well. Please don't put any pressure on him. You be the one to care for him. Encourage him to go for a checkup.
Yeah.
It is not just about that sustenance on that table because that sustenance is coming from somewhere. He needs that physical strength. You could see the room. And I said, listen, let's encourage our men.
Yeah.
Let's not put so much pressure on them. The school fees has not been paid. Please. When we prioritize the health of our men, not let, because they would never prioritize. That is how they've been wired up.
Yeah.
They've been wired up provision first,
Mm-hmm.
yourself last. We
Mm-hmm.
always put people first, and men will put the parents, the children first before themselves. We
Yeah.
need to shift that and we prioritize them. And that is how these symptoms may be there, but no. If you enter into a dialysis unit,
Mm-hmm.
you are more likely to see more men on
Mm-hmm.
dialysis than women.
Yeah.
There are more men on dialysis than women. But in theory, there are more women with chronic kidney disease than men.
Oh, okay. That's interesting.
There are more women with chronic kidney disease than men. A bit of it is research. If we were to do a survey and I put a survey leaflet through the door, the women are more likely to complete that survey than men.
Yeah.
So we know of more women with chronic kidney disease than men. If a woman doesn't feel well, she's likely to tell her friend, who is likely to convince her to go to the doctor. But
That's
when a
true.
man is not feeling well, he
Mm-hmm.
would keep quiet until
Yeah.
that thing is so. This is why statistically it shows that way, but
Yeah.
actually, in
Their
reality,
health-seeking behavior.
yes.
Yeah.
Yeah. So the health-seeking behavior and self-caring behavior are totally
Mm.
different based on gender. That is why we as women, we need to look after our men and then prioritize their health.
Yeah. So, uh, well, if you're going to listen to this later, right now, what has stuck in my head is that my kidneys are my caretakers, the
Yeah.
caretakers of my body.
Mhm.
Let's just picture it this way. When you are in the house and you have a house help
Mhm.
who does everything in the
Yeah.
house,
Yes.
the moment that that house help is not well, that means that the rooms will not be
We cleaned,
swept, the
no
dishes
food.
will not be washed,
Yes.
everything. So the house becomes unclean and
Very unclean.
everything falls down.
Yeah.
So the moment something starts getting amiss with you or you don't feel well, think about these. Let it
Yeah.
be part of the things we think about.
Definitely.
Okay.
Definitely.
All right. Now,
Definitely.
we were talking about the men, and
Yeah.
then we've been speaking about the minority, the cultural aspect of
Mhm.
things. How do cultural beliefs or community narratives shape
Mhm.
how people interpret symptoms?
Hmm. Culture shapes meaning. So when I say this, I culture shapes meaning. So if culture shapes meaning, then in some cultures where tiredness is seen as normal,
Yeah,
you feel tired, it is normal to feel tired.
don't talk about it too much.
Yeah. Oh, your feet is swollen. What would they say? Ah, you've been standing up for a very long time. Or the salt in your diet is a bit too
Too
much.
much.
That is why. Oh, it's the weather. Today the weather is very hot. That is why you're feeling that way. Or you're having headache. It's stress, stress at work, stress from children, stress
Mm-hmm.
from other things, stress from money. What about high blood pressure? I've talked about that. My mother thinking high blood pressure is the stresses of her children. But also people would say, you get older, you get high
Yeah.
blood pressure. So these things, culture in itself is shaping that meaning. So
Mm-hmm.
if that individual even is registered with a GP and they go to the hospital and then they are telling the GP about having this headache, you would think the GP would also be thinking, okay, what else may be there? But yeah, you have headache. Okay, paracetamol. Go and rest. So that whole opportunity is then missed.
Yeah.
And the narratives, if we think about it, for us, it is more of the narratives around it. A lot of healthcare professionals, we've not been trained to listen to the narratives. We are so much of numbers.
Yeah.
What's the number? The number is, I said this to a colleague. She said, how about Roseline? I said, okay. So let's say we have 10 oranges in a basket. The number is 10. She said, yes. So you can see 10. She said, yes. Okay. Now, if you can only eat three, is it good? She said, no. Then why did I buy 10? I said, precisely. So the numbers, whilst it is good, the quality, the narratives around it, because a lot of ethnic minority, we are very narrative. We come, we tell a story. Majority of us are not direct. We come in, we tell you boom, boom, boom. We come in with a story. So if the system has not been designed to listen to the narratives of the people, we are
Mm-hmm.
going to miss it.
Yeah.
And culture shapes what I worry about,
Mm-hmm.
what I talk about,
Yeah.
and what I seek help about. It
Mm-hmm.
is all, sometimes people think about culture as the way I eat and dress. No, culture is huge. The way I eat, the way I speak is just the tip of the iceberg. But culture shapes how I make meaning, how I make sense in every day, how I communicate, how I value other people, how I see my own body, how I interpret what is happening to me. And when healthcare professionals have not been trained to have cultural intelligence, to understand that I come into the healthcare setting with my whole culture. So if we do not understand that, we miss the whole plot. I'll give an example. I have an elderly Asian man come into my clinic. So I'm sitting there, I'm looking at his medication. He's on about 10 medications. So I'm sitting there scratching my head. I'm thinking, trust me, which of these medications are you going to take out? This is what my colleagues hate me for. Not add. Which one are you going to take off? So I sat there and then I said to him, I said, what do you do in your community? The man is surprised looking at me. I said, yeah, what do you do in your community? He said, I'm a community leader. Okay. What do you do? Oh, I attend weddings, naming ceremony, other social events. Okay. And when you go, what do you do? Well, there is food, isn't it? Our culture is about food. So there is a lot of food. Okay. Then he sat there for a while and then he said, this is where I have a problem. So I said, calm down. What's the problem? When I go and I don't eat because of my kidney disease, then they would say, what is the purpose of coming here? There is food
If you
here.
only.
You are not eating this food. You don't like our food. Then
Mm.
they'll go and tell my wife. Then when I go home, she'll say, you go out, you disgrace me. So I'm thinking, okay, and then I come to the clinic and then I am being told, oh, I am not managing my diabetes well. I am not managing my blood pressure. So
He
they
has a
said,
he has a he has a real problem. He has a real problem somewhere. Yeah.
so I said to him, I said, let's see whether we can have a plan that will
Yeah.
work. So he said, what's your plan? And then I said, let's hear what your plan is. He said, I was planning to stop the social engagement. I said, no, that is not a good plan.
Mm-hmm.
Actually, what I'm going to recommend, continue going for your social event. And then he said, really? I said, yes. Now, here is the plan. Let's see whether that works. Go pick your plate. Fill your plate with what you want to eat.
Mm-hmm.
The plan is that don't stay in one place. Keep moving with that same plate. Keep moving. So everybody sees that your plate is full. When you stand here for 5 minutes, you move to the other place. When you go to your plate is still full. Everywhere you go, people will think you have just filled your plate everywhere, but it's the same plate. Ah, this man just got on his knees and said, can I kiss your feet? I said, no, please don't do it.
You solved this problem just by listening
He
to
said,
him. That
why
was
hasn't
brilliant.
anybody told me this?
Hmm.
Why
Yeah.
hasn't anybody told me this? He said, no, wait, he took her phone. I need to call my wife right now.
Practical solutions.
So he said, so then I said, no, I'm not going to add. In fact, I actually want to take, because you're already taking three medications for diabetes, I want to take one. But I want you to come back after 6 weeks. Let's look at how things are going. This
Yeah.
man had one diabetes medication taken up, one blood pressure machine, because he didn't need it. What he
He
needed were
didn't need it.
practical strategies to
Solution.
help
Yeah.
him cope.
Yeah.
And as healthcare professionals, that is what we need to do to People need practical solutions. They don't need
Most
theory.
take the medications first, and medication, you know what, I always say that the medications are supposed to be like our last resort. But now it has become our first solution that we present to patients because nobody has the time, nobody wants to have the time to listen. Because it took you some time to listen to him,
Yeah.
try to figure out what your activities are, and then think of something other than giving him another medication or something to say, oh, you are not doing this well, so let's give you something else.
It's the
That was
system
brilliant.
design. Yeah, it
Yeah,
is the system design
yeah.
because I get told by my colleagues, Roslyn, your clinic is running late. Yes, thank you. Roslyn, your clinic runs late. Yes, thank you. Roslyn, please don't run your clinic like that. I said, could you just focus and run your clinic? Let me run my clinic. Oh, no, it's not fair. Sometimes we end up having, okay, I'm going to take the patient I'm seeing today and I'm going to tell them I'm going to be a little bit late. Is that okay with you? Because when we have that time, to explain things to patient,
Yeah,
we end up actually saving the NHS money and we save the patient pain because so, there was no point. Those two medications I've taken up, that is a savings to the NHS, but that is less stress for the patient because
yeah.
the more medications we prescribe, the more stress that individual becomes. And the more likely they're not going to take it. So
Well,
why?
multiple medications are also a risk
Yeah.
for them. Yeah, it is
Why
a
give a
risk.
patient something they wouldn't take when a practical solution, which a lot of people are more likely to have a practical solution than taking the medications?
Yeah.
Sometimes I only ask patient, tell me about your medications. And then they'll sit there and then they'll look at me and I smile. Yeah. And then I said, oh, thank you very much. And then they'll say, oh, I've not told you anything. I said, no, the smile is enough. You told me. Because the thing is that if you cannot remember one tablet, you are not taking any. I don't need, and this is that I don't need to ask you, are you taking your tablet? Who wants to be ignorant? No,
Yeah,
nobody will say no. So it's finding that subtle way. It may be that that tablet is not working for that patient and that another option. But if we don't explore it that way, that
yeah,
individual would not know and we wouldn't be able to help that individual and help our system as well as individual healthcare professionals. Yeah.
yeah. So cultural plays it plays a big role.
A big role. Cultural
Yeah, in
intelligence
how,
plays
yeah,
a significant
yeah,
role.
in how people approach their health.
Yeah.
Well, who should be paying attention to their kidney health, even if they feel
Mm.
well?
Here is the thing.
Mm.
People who have diabetes,
Mm-hmm.
and the reason being that with diabetes, because the body is not able to
Yeah,
effectively manage sugar, the
yeah,
trick is that this caretaker kidney regulates excess sugar.
yeah,
So once the pancreas is not able to secrete enough insulin to take the glucose sugar from my blood to the tissues where it is needed, there is spillage of glucose in my urine and
yeah,
in my blood.
yeah.
In my blood, this glucose is making my blood very thick. It
Mm-hmm.
is flowing very slowly and it's
Yeah,
causing damage, especially to the kidney tissue itself. It is eating the kidney tissue away. So if people have diabetes, what I'll recommend is that every year the GP checks their kidney health,
yeah.
blood and urine test. If that has not been done, please ask the GP to do it. Second, hypertension.
Mm.
When the blood pressure is very high, this unsung hero, this caretaker, is made up of tiny filters. They are as tiny as one strand of your silky hair. If you can pick just one strand of your silky hair, that is how tiny. And because they are this fragile, they cannot withstand pressure. And that is hypertension. That is what
Yeah,
hypertension, that they cannot withstand that. Unlike the blood vessels in the brain, which when the pressure is very high, they burst because the
yeah,
brain is contained in a capsule. They burst, people get stroke. The danger with the blood vessels in the kidneys is that they are so tiny, but they need they need oxygen themselves to be able to do the work. So think
Function.
about
Yeah.
your caretaker needs fuel to be able to work. So if the pressure is very high, one, they don't get that fuel, they don't get that
Yeah.
oxygen, and then they die. They don't burst, they die. So diabetes, high blood pressure. Also, if there is anybody who has a family member who has chronic kidney disease, is on dialysis, or have had transplant before, they need to be mindful of their kidney health.
Yeah.
Anybody with heart disease. So people say, Roseline, why heart disease? The heart and the kidneys relate.
Yeah.
Every single pump action of the heart, the kidneys receive a quarter of that blood from the heart. So
Mm-hmm.
if somebody has a heart condition, it's only a matter of time that pressure would be transferred onto the kidneys. So anybody with a heart condition needs to look at that.
Yeah.
And then the last thing I would say would be pregnancy, especially if the individual developed hypertension or high blood pressure during the pregnancy. They need to also be mindful and make sure that they are getting their kidney health check. But overall, we would all benefit from looking after our caretaker.
Yeah.
We would all benefit from looking after our caretaker. However, for those four areas that I have mentioned, high blood pressure, diabetes, heart condition, and then any risk or any related problem during pregnancy, those individuals need to be mindful and then get their kidney health check. The GPs generally will check kidney health for individuals with high blood pressure, diabetes, and then heart disease, but sometimes that doesn't get done.
Yeah. Hmm. I know you've mentioned that having these conditions, it's good to have your kidneys checked once a year at least.
Yeah,
What other practical steps can people take to check their kidney health?
right. First of all, I always like people to look at their urine when they pass it.
Hmm.
What is the color
Of
of
my
my
urine.
urine? If my urine is straw-like, my urine is smiling, my kidneys are happy, my caretaker is happy. As the color changes to deep yellow,
Mm-hmm.
orange, my kidneys are crying. Because like my caretaker needs fuel, the kidney needs fuel. One of its fuel is water. And without water, yesterday somebody said to me, Roslyn, so literally what you're saying is it's like I have just put my stuff in the washing machine and the tap is not running and the washing machine is running.
It's
I
running
said, yes.
dry.
It says, so it is running dry. So even if the cycle is completed, when I take it, the clothing is unwashed. I said, you got it right there.
Yep.
We need to give the kidney its fuel, water. The other practical step is what is going inside my body. If
Yeah.
I am thinking that my caretaker is going to clean the house, do the dishes, do the laundry, what other stuff have I put in the house such that I am wearing this caretaker? Because the more unnecessary stuff I give her to do, the likely she's going to get tired. And the following day, she would phone off sick
Yeah.
and not come.
Mm.
And then I would have to figure out these things by myself. But unfortunately, with the kidney, there is nothing else. My kidneys are tired.
There is nothing else.
There is nothing else.
That one, yeah.
There
There
is
is
nothing
nothing
else.
else.
Yeah.
Yeah. So check your urine.
Check your urine. Is my
Very
urine smiling?
simple.
Yeah.
Very simple. When you have your wee, just check it. Is it clear?
Is it clear?
If it's getting darker or more yellow,
Yellow, deep
deep
yellow.
yellow,
Yeah.
you know that you should be doing something better.
Drink more water. Yeah.
Drink more water. Get
Drink more water to hydrate
some
yourself.
liters of water inside your body.
People
Okay.
ask, so how many bottles of water or glasses of water are we meant to drink in a day? And then I said, okay, here it says 1,500. So the person said, what do you mean here? I said, okay, we are in a temperate region.
Mm-hmm.
It is cold here. Here you don't sweat. You see,
Not
summer,
at all.
you only have summer for what? How many months? I said, the reason why sometimes a lot of people in Africa, in sub-Saharan Africa, are getting chronic kidney disease, we are not drinking and we are sweating like hell.
And we have told it's 1.5.
And I said, once you see that sweat pouring out, you need to fuel,
Fill up.
you need to put all that fluid back in there.
So would it be safe to say that when here
Mm,
in the UK or in the colder regions, if
mm.
you're being told 1.5, then if you are in the temperate regions, you better
You
be
need to
doing double.
you need to drink more. And
Ah, that's the miscommunication that we are
during
talking
summer,
about.
we need to drink more because summer
Yeah.
we sweat. We need to drink more.
Yeah.
One fascinating thing I learned about the whole body,
Mm.
earth, one third of 60% of earth is water. It's the same with the body.
Yeah.
60% of the body is water, but we don't talk about it. No cell can survive without fluid.
Without water. Yeah.
We need that water. So we need to drink, and our urine say, I said, the color of our urine says it all.
It
It
speaks
speaks
volumes. Well,
volumes.
sometimes it's not just the color, it's even the smell. Because if it's clear, but if it starts giving you vibes, I mean, you know that you
It
have to do
shouldn't be
something.
smelly, and most importantly, it
Mhm.
should not be foamy.
Oh, I've not heard that foamy part. I've not
It
heard
should
that.
not be foamy.
Okay.
So sometimes people say, why will I end up with a foamy urine? First, you have to ask yourself, have you had a lot of fizzy drink or
Mm,
acidic drink? Then
yeah.
it will be.
Energy drinks.
Yes, but if you're not having that and your urine is foamy, then we have a particular condition that causes that. You need to see your GP
Okay.
because a foamy urine is not normal.
It's not normal.
Yeah.
Okay. How can people feel more confident advocating for their health? And this is very important
Mm.
to me.
I think the key thing is, first of all, is the healthcare system designed to acknowledge people telling healthcare professionals what their issues are?
Mm,
Like a colleague said to me, Roseline, I love an intelligent patient, but sometimes I also feel that my patient is telling me what I am supposed to do. So I said, I can see a bone of contention there. And then I asked my colleague, I said, which one would you prefer? That you talk to the patient and the patient goes and doesn't do what you agreed, or you get a consensus, a collaboration, and the patient leaves the consultation feeling empowered to take care of themselves. They
yeah.
come back to you, and then you can see impact. And then he said to me, yes, Rosie, you're right. But it all goes back to how we were trained. And then I
It's
said,
true.
we can all say that it goes back to how we were trained. But if we look at current, what is happening, a lot of doctors didn't know how to use computers. A lot of doctors didn't know how to use AI. But what are we doing these days? And then she said, yeah, you're right. A lot of us are self-taught. I said, your grandparent did not use a mobile phone,
Yeah.
but some of our grandparents are now using mobile phones. Why? They have learned. So we have no excuse to say, this is how I was trained, because the system has changed and we have to change with the system. We cannot, as a friend, he said, Rosin, do you know why the dinosaurs became extinct? I said, please don't start with that story. So because they refuse to change. They refuse to adapt. As
Hmm.
healthcare professionals, we can see that our patient demographics have changed.
Yeah.
We can see information is readily available and our patients are consuming that information before they come to us.
Yeah.
So we need to be ready to listen and share that power with them. Without sharing power, it is not going to
It
work.
can't work. Because if you feel like you are the only one that should be telling them what to
No,
do, you don't want
no,
to receive their feedback,
no.
then you're going to have a struggle. Because no, I don't want to listen to you because you're telling me what to do. And I get that a lot. Because when patients start asking questions,
Mm-hmm.
then healthcare professionals go like, you're being difficult.
No,
But that's not being difficult. Are you
no,
listening to what the person is saying? They are not challenging your
no.
authority. They just want clarity. And there is a very big difference.
It's the way the system has been designed to, you
Yeah.
are there. The patient is passive. It's interesting. It's interesting when I look at that dichotomy. We talk a lot about self-management, patient-centered care.
Mm. No, that's
We
that
have
term
all
is
those
very
theories.
it's used loosely, very loosely.
And then when I ask people, what does it actually mean?
Mm.
Because confidence grows when people feel heard.
Yeah, that's true.
Confidence grows when people feel heard.
Yeah.
So there are some patients I have who, when they are going for their clinic review, I will speak with them. And then I say, right, write your symptoms, write it down.
Mm-hmm.
And when you go to your doctor, I said, even though we say we have that, you have your first 3 minutes, you have all of that, it still doesn't happen. So when you go to your doctor, write your symptoms down. And then
So
what I want you to do is that rate them in category. Which one? Give all of them number.
yeah.
So the one that you want to raise first is the one that you have given the highest number.
Mm-hmm.
So write it down. If you're unhappy about a previous consultation, write it down. When you go to your GP, give it to your GP or give it to that doctor, or you can write to that doctor directly, or you can put in a complaint. It is about giving people a voice. And I
Yeah.
believe that when people are heard, their confidence grows.
Yeah, of course.
And
Of
if we
course.
want people to communicate with us, we want things to be better, that is what we have to do. I
Yeah.
don't need to go to medical school. People don't need a medical language to communicate with a healthcare professional.
No.
Priscilla, all they need from us as healthcare professional is permission to speak, permission to be heard.
Yeah.
That is all.
Yeah. Because most people do not know. I get a lot of patients in the A&E, and they are, you see, one thing I share this story. There was a patient in my unit. She had oxygen in her nose. She had the nasal prongs in.
Mm,
And this was a really chronically ill patient because
mm,
he was in a resuscitation area.
mm,
Now, we were changing her from a trolley onto a bed
mm,
to make her more comfortable.
mm,
But as we switched the trolley to the bed, I think her nasal prongs might have fallen
falling off.
on the floor.
Yeah.
And then we moved away from the patient.
Oh my
But
God.
as I sat down, nobody noticed. Now, as I sat down, I was looking at her and I felt she didn't look quite well to me.
Yeah.
Now, at that time, I had not actually seen that
The
the
nasal
prongs
prongs. Yeah.
were off, but she just didn't look well. So I went to her and I was asking, "Are you okay?
Mhm.
Are you struggling?" Then she nodded, and I said, "Okay." She said, I'm not breathing well." And then I checked her SATs on the monitor. I saw that it had gone down. So I
Mhm.
checked and I said, "Oh no, the nasal prongs was on the floor." But this was a patient. She was alert.
Mhm.
She could talk, but she was sitting and struggling.
Yeah.
I asked her when I put it back, I asked her, "Why didn't you say anything?" She told me, "I didn't want to be a bother." And I hear that so many times. I'm like, you are not bothering
No.
anybody. You are the reason why I'm here.
Priscilla, I think that the thing is about, they say it that way, but how I understand it is about psychological safety.
Oh,
We
it
have
is.
not created an environment where people can tell us what the issue is,
Yeah.
because it's like somebody said, yeah, I came to the hospital and then that is the nurse. They were just telling me up. And I said, how does a nurse feel when they go to see their doctor and then their doctors are telling them, oh, they don't like it? So it's not something that we have to do.
No, no. It's
We
something
have to
we need to
create
correct. It's yeah.
We
Yeah.
have to create that environment where people are free to
Yeah.
speak. If we want this healthcare system to change, we need an environment where, first of all, patients are free to speak up,
Yeah.
staff are free to speak up,
Yeah.
and not hide from. Because yes, we are bringing our culture and the patient is also bringing their culture. We need to recognize that and
Yeah.
actually encourage the patient. What is it?
Yeah.
What
That's
is
true.
it?
Yeah. If more people understood kidney health earlier, what do you think would change?
Mm, that is my bread and butter.
Let's make
We
some
would,
tea.
we would see earlier diagnosis. That is the
Yeah.
first thing. We would
Yeah.
see earlier diagnosis. Fewer people starting dialysis suddenly.
Mm,
We would have fewer crises. Yeah.
yeah.
So this is a friend's brother, unwell, started bleeding, perectum, goes to the hospital, and then within 2 days is on dialysis.
Hmm.
That is crisis.
Yeah.
If people understood kidney health earlier, we would have more time to prevent chronic kidney disease. We would see reduced fear when people come because we have prepared them. To be told you have chronic kidney disease and you need dialysis that same day, that is huge.
Yeah.
And if we people understood that, if our healthcare system is designed in such a way that we start prevention earlier, we go upstream, find the people. There is no point telling a patient about diabetes without mentioning the impact it will have somewhere along the line in
Yeah.
terms of their kidney health. There is no point talking to a patient about hypertension without mentioning that because that is a journey. And when people know, people are more likely to take their time, look after their kidney health, and preserve that.
Yeah. That's
And we would need less dialysis unit. Interestingly, Waste Treating last year asked us, as a renal community, are you just going to go on building new dialysis unit?
mm, mm.
Because dialysis, this is what people don't talk about, Priscilla. Dialysis is expensive.
It is expensive.
250 pounds per dialysis session
Mm,
for one person. Each patient dialyzes 3 times a week. That is 750 pounds. That
mm.
is 3,000 pounds a month. That is 36,000 pounds a year. Who is paying for that?
We are.
Yes. And we've only talked about the money side, but let's talk about the humanistic part. People come for dialysis, they finish dialysis, they are tired. Where is that time for them to enjoy family? If
And
that
then they don't
person
get to go to work. So,
if that, yeah, this is the thing. So some people are blessed enough to have a job that they are employed, but others are self-employed.
yeah.
So for those who are self-employed, how then do they navigate around this? So
Mm,
sometimes a patient who is self-employed might choose not to come for dialysis today, or
mm,
they would come in and then not complete their hours because there are a whole lot of socio-economical and other factors involved in dialysis.
yeah.
Transplantation is not a cure. Transplantation can fail. Once we now have newer medications such that we can keep a transplant organ lasting longer, transplantation is not for life. It will fail. Transplantation on its own also has other complications because you have received somebody's organ, you need to take immunosuppressant. And some people go on to develop other things. Like a patient said to me, all I wanted was a kidney to have a healthy life. Now I have diabetes because of the immunosuppressant.
Yeah.
So it is not an absolute cure. Now, because we have the shared scheme, so more and more people are having transplantation, which means that they don't need to stay longer on dialysis. But transplantation is not a cure. Prevention is
It's key.
better
It's key.
than
Yeah.
cure.
Yeah. Wow. Wow. I feel like I've had a whole lesson. No, I'm serious. I've had a whole lesson and I love every bit of information that I have gathered today. It's a class on its own. I think we're going to have to do this again for nurses because yes, I am so bent on making sure that we actually have nurses who know what they're doing for our patients. So I'm
Yeah.
sure we're going to have this again. But what's one key message
Mhm.
that you'd want everyone to take away?
Hmm. Hmm. The one key message I want everyone to take away is that kidney health becomes visible earlier
Mm.
when we learn to hear the heartbeat underneath the numbers.
Ah.
Kidney health becomes visible
Eh,
earlier when we learn to hear the heartbeat underneath. Because, like I said, it doesn't shout, it doesn't erupt, but
mhm.
there are tremors underneath. If we can hear that, spot those early signs and symptoms, not ignore the early warnings, not normalize it, but seek help.
Yeah.
That would enable us to make this hidden visible earlier.
Wow.
Also, as healthcare professionals, and I'm hoping that there are healthcare professionals listening to us, we need to understand that kidney health is not about the patient,
Mhm.
but it is cultural. It is communicative, cultural intelligence, communication ethics. It is about relational and culturally rooted communication with people. When we are able to get to that level of understanding the patient, our patients live empowered. They feel safe and they can then explain and talk to other healthcare professionals
Yeah.
about what they are going through. When we do that, lives will change.
Wow. Oh, I wish you could go on and on and on and on. It's been great. I am so happy we did this. This is what we call a public health education.
Yeah,
Thank you so much, Rosaline. I have loved listening to you and sharing thoughts and ideas. And I know this is not the end. We're going to do it again. We're going to
yeah,
replicate it somehow.
definitely, definitely.
Thank you so much. This has been Raising Health. Hi, Prof. Linda. I think she's gone now.
Yeah,
Um, we've been talking to Roseline Agyekum. She is a kidney nurse researcher and a clinical educator. She is wonderful and she's brilliant. I'm so happy and I'm so honored that I got to have this chat with her. I have been your host, Priscilla. I'm a nurse and I'm a public health professional. This has been nice, and I really hope that you got something to go home with. Kidneys are your caretakers of the body. Treat them well, and then they will keep you healthy. Thank you so much for being a part of this. Wherever you see this, please share it with your family, with your friends, and even more importantly, with other healthcare professionals because this was for everybody. Thank you. And till we have another episode, take care and be good to your body.
I think. Thank you. Thanks. Bye.